Hello everybody, what's up? How are you doing? I'm on here. I know it's kind of late. I'm gonna hurry up and try to get through it and explain things uh, the best way that I can without leaving anything out. And I might have to do a part two of this video. Um, so today I uploaded a video while I was in the doctor's office. I had to go get my blood drawn and just they wanted to know how I was doing. Just keeping up with my health, making sure I'm not having any complications or anything like that. So I had to get blood work done. This specific type of blood work is called DSA. DSA is a donor specific antibodies. Okay, one of the established biomarkers for predicting antibody mediated rejection. This is what I was diagnosed with back in October of 2020 when I got really sick. My body shut down. I was in the ICU for probably 7 days. I'm not for sure. I was out of it. I didn't know what was going on. But yeah, so because I had the antibodies mediated rejection, um, they wanted to, because I had to get all these other treatments to lower the antibodies or get rid of them completely. Um, and they have to monitor to make sure these antibodies don't come back or the level don't go up. So, um, so the DSA, okay, it can be performed before you get transplanted, or it could be done after you get transplanted. Um, so the DSA testing, the purpose of the DSA testing is to monitor patients after transplant for the presence and level of antibodies to the donor's HLA uh, antigens. Okay, I want to make sure I'm saying it right. Antigens. And so, what happened with me? My donor's antibodies was present back in March of 2020. At this time, I was um, visiting and doing all my heart transplant care up at Penn Medicine, located in Philadelphia, Pennsylvania. So when I got a biopsy in March, antibodies were detected. And I think I did have a rejection in March, but it wasn't the AMR rejection. It was just like a cellular rejection. So basically, I guess the levels was low that they did not act aggressively to get rid of the antibodies. So, um, so the definition of HLA stands for human oh, this is a long word. Let's see, leukocyte antigen. Okay. If I'm not saying it right, I apologize. These medical terminologies and these words are long. um, the HLA antigens are proteins found on most cells in your body. These antigens are inherited as a unique set from your parents. They allow for the regulation of your immune system. Okay, so if I have these donors, antibodies showing up in my body, and my immune system, of course, is going to, well, basically attack the heart. And and so And also, just look at my heart as being foreign. And then the antibodies from the donor can cause damage too. So, so that is why I had to get the DSA testing done today. And so I just wanted to go back a little bit to how I got through this journey. I done had every, if you want to say, every type of treatment done. Some of these I haven't even heard of before, and I had to get them done. So it's like I've been through a lot as a transplant patient. And my purpose of always doing these videos is to inform you about especially families who have somebody is waiting for a transplant. Now, I can't speak from the perspective of a lung or kidney or liver transplant, but I know that we do share some of the anti-rejection drugs. So I pretty much know what you're going through. But I am more so like, I know more about the heart transplant than I know anything about any other organ transplant. So I always get on here with the intentions to always try to reach out to those who are wanting to get a heart transplant, who already has one and maybe going through something, or, you know, just anybody who have experienced transplant. So it's like I've been through the whole stages of having an LVAD. If somebody want to talk to me about the pros and cons of an LVAD, I mean, I've been through a lot. And I'm going off subject for a second, but when people say that to me, like, I really haven't digested the fact that my body has been through a lot. I had 2 heart surgeries. Um, you know, and I'm about to be 35 next week. But like when doctors and a lot of people say, "Oh, you're so strong, you're a miracle. You've been through so much and you still have this positive attitude." And my whole thing is my son. Like, I'm a single mother, and I feel like nobody would ever take care of my son the way that I would. And so the reason why I am so strong is because I'm a mother. Another reason I'm so strong is because I'm a woman who never gives up. Like, I don't take no for an answer. And so it's like I challenge myself, even on days when I feel like, I don't want to do this, I don't feel like it, but I know the outcome if I don't do it. If I don't get up and say, okay, I got to make this doctor's appointment regardless, I may be tired, I may be in pain, but it's like I have to make sure and maintain care of me so I could be here for my son. Honestly speaking, like, I don't always process things like I said. When they say that you're strong, you're determined, like they never met somebody who's been through so much and still, maintain this positive attitude, and they call me brave and a miracle. And it's just like, I don't I don't process that. I just look at it, that's what I have to do. I don't sit back and say, you know what, Christina, you could have gave up. You could have just put your hands up and say, you know what, I can't do this no more. The pain, the different type of treatments, the just all the hospitalizations, and being like physically recovering, mentally trying to recover. it's a lot that can weigh on you. And no, by no far am I have my bad days. So I always try to look at God has had, kept me here for a reason. I have a purpose. And I always say, like, this is my testimony. Everything that I've been through, and I'm still here. And so, why not channel that positivity, um, just loving life? Why not channel that into reaching out to anyone who is experiencing medical situations, even when it comes down to being a diabetic. Yeah, that's very hard for me to go from never having to deal with, my blood sugar level and just being able to eat whatever I want to eat and not worry about, okay, I got to take my insulin before each and every meal. I got to watch what I eat. I had to make a lot of adjustments. And so I can relate to a diabetic. So it's like I can just relate to so many people out there with different type of medical things as it surrounds um, transplant. I'm not an expert. I only speak from my experience, and this is my testimony that I share, and that's really what these videos are about. So, back to what I was saying. So, my first hospitalization was I went in September the 27th at MedStar Washington Hospital Center. And what happened was I was having shortness of breath. My chest was feeling like real compressed. And so my doctor at the time, she told me to do some breathing treatments to try to open up my lungs and use my inhaler. And then she also wanted me to go, if that wasn't better, go the next day to get a chest x-ray to see what was going on. So I went, I ended up going early that morning the next day. And I went to Kaiser Permanente, urgent care. So they took x-rays and coming to find out, I had a rejection. I was, my heart was acting kind of funny because they took an EKG and an x-ray. So my heart was looking kind of funny. They found on the x-ray that I had a pulmonary embolism. So that's a blood clot that's in your lungs. That was also causing me to have breathing problems. And it was causing like fluid to like build up around my heart. And that was another cause of like me not being able to breathe and stuff like that. So I was there from September the 27th through October the 3rd at MedStar Washington Hospital Center. Because I was not a transplant patient of theirs, and I was still getting my care through Penn Medicine in Pennsylvania, I had to be transported in an ambulance up to Philadelphia. And they transferred me October the 3rd, and I stayed in Philly in the hospital for 7 days, October the 3rd through the 10th. And I was getting treated for an acute cellular rejection. I had a 2R, which is a mild, it's like a moderate mild rejection. The main thing, was the pulmonary embolism, because the blood clot could have traveled to my heart, and I would not be here right now. And another thing I want to say, like, always listen to your body. Like, how you feel when you're feeling healthy and normal. And you should be able to tell when something changes with your body. Nothing is too small for you to be concerned about. If you feel something isn't normal, you feel like it's a change, contact your doctor immediately or call 911. Okay? Because that makes a difference whether your life can be saved or not. So there's no such thing as, oh, this is little. No, because if it's little, it can turn into something big. So please, please, everybody, regardless if you have a medical condition going on right now or not, always listen to your body. Um, yeah, and so when I was up in Philly, um, they actually treated me with, I had got actually one dosage of the IVIG, was is the immunoglobulin. I think I'm saying it right. To help with the rejection I was having, and also because they antibodies were found in March. They also wanted to get rid of the antibodies that were found in March as well. And now I had, how many doses? I think I have four IVIG treatments, and I got it through my vein, my eye. You know, they put in the IV, and so the acute cellular rejection is different from the antibody mediated rejection. So, you know, the ACR, which is called the acute cellular rejection, the most common type of rejections. I have had these in the past. This happens when your T cells, part of your immune system, attack the cells of your new heart. So that's what I was having at that time. Um, the immune system can see the grafted organ as foreign and attacks it, destroying it, leading to rejection. So, this is where we come back, where I can always say, like, you know, that's why you have to take your anti-rejection drugs, immunosuppression drugs, the Cellcept, the tacrolimus, to help with prevention of your body attacking, well, your immune system attacking your new heart, because it's foreign. It's somebody else's heart. So this is what I was diagnosed with on 10/3 through 10/10. Okay. So I get discharged on I get discharged on 10/10. I come home, and you know, I'm staying in the house because they say the IVIG, it compromises your immune system. So they want you to stay in the house away from people because you're more susceptible to getting like sick because your immune system is just so low. Um, so on 10/12/21, I started having pain in my, like in between here, both hands. This arm was swelling up. Um, both of my feet, well, it was mainly the right leg and the knee, and the crease between the pelvic bone and where the thigh meet at the top. And so I was having increased pain, like severe pain. And you know, I was just like, okay, this is kind of weird. Like, let me take some Tylenol and see what happens. Because often, you know, you can get cramps or whatever. Um, and so I have had like kind of like pain in my knee before. Just by carrying a mail for like over 15 years, your joints start to hurt. So, you know, I really didn't like I said, I'm going to see how this feels, I'm going to go lay down. I'm going to put a hot pad. I took Tylenol. So the pain just kept increasing. And I said, well, I'm going to go take a nice hot bath, try to, help my muscles relax. Um, as I got to the bathroom and start to um, undress to try to get in the tub, this sharp pain just took me, like, I could not move my right leg. And I immediately called 911. Like, I was crying, I was in pain. My mom was here at my house. You know, she was helping me out because I had just came home from the hospital. And so I needed help, and I didn't want to be here by myself just in case something else happened. And thank God my mom was here, because if I would have been here by myself with Kingston, I don't know what I would have done. Like, I would have had to wait it for someone to come get Kingston, but thank God my mom was here. So I called 911, the ambulance come. I'm able to walk on the left leg, but the right leg is just totally in pain. And my hands, like, it was so weird because it was only in this area where I was feeling the most pain. I could not grip nothing without it being painful. Like, I tried to turn on the faucet, and it was just, I couldn't do it. The pain was just unbearable. So I got, the ambulance came. They took me to Nova Alexandria, and they ran all these tests, blood tests. They took X-rays. They took what else did they take? They took an X-ray. They also did an ultrasound of my veins and stuff in my legs and in my arms, and they didn't find anything. So they sent me home. They just basically wrapped my hands up and wrapped my knee up and sent me home. And they said they couldn't figure out what was going on. So the next day, overnight, it kept getting worse. So the next day, October the 13th, that was like just boop, done it. Now both of my arms was hurting, both of my legs, I could barely walk, and this is real. My body was shutting down. I could barely put my clothes on. I could barely put my shoes on. When I had to get in the little, I guess it's made like a wheelchair, but it's something that the paramedics use to get like the patient like down the steps or whatever. I could barely turn and sit in this chair. I could barely get on the stretcher that was outside to get in the ambulance. I was just in so much pain. They take me to Washington Hospital Center and to the emergency room, and I'm in there in pain, and they're giving me, I think they gave me morphine. That was not working. If they tried to touch my arms, like at this point, both of my arms were starting to swell up. This one was already swollen, but both of my arms had started to swell up. If they touched me or try to turn me or move me, or I try to move, the pain just started shooting. Like, it was just so unbearable. And, in the past, after surgeries, they have given me Dilaudid, and that's the only thing that works for me, that help with the pain. Morphine does not work Fentanyl, I can't take. I'm allergic to fentanyl. So, but Dilaudid was the only type of pain medicine that I could use that would get rid of the pain. In the ER, they don't carry Dilaudid. You have to wait until you get up on the floor to your room, and then the doctor can prescribe Dilaudid, which I think is dumb. But so as they're giving me morphine, I'm like, this is not working. I'm in extreme pain. They're asking me like, what happened? Did you fall? Did you twist something? I said, no, I didn't do none of that. I'm just, this pain just came on all of a sudden, and it got worse. And so from that point, they take me upstairs to my room, as a heart transplant patient. And I think all transplant patients, they get their own private room because um, our immune system is compromised and we cannot be in a room with someone else who may be sick because that would cause us to get sick. So we get our own private room. So as I go up to the room, I'm still in pain, and I'm telling them I need something stronger like Dilaudid to help with the pain. But they're still trying to touch me like my whole body was in pain. And they were still trying to touch me to assess me. And of course, I'm angry because I'm like, don't touch me. I told them, like, I will move over myself. I'd rather for myself to do it because I know how much weight I can put on. You guys don't know. Like, y'all just want to pull this arm, get an IV. No, y'all not going to do that. And another thing I will say, be your own advocate. If it's something that you don't agree with, you don't like, open your mouth. If you feel like this particular nurse or doctor, whatever, is not giving you the proper care, the proper treatment, do not hesitate to call patient, um, advocate, and it's another one you can call. It's another number you can call. But trust me, they did not like me because I was able to stand up for myself. I wasn't taking no BS. And so I'm the type of patient, you're just not going to tell me anything, you know. So I didn't want none of them to touch because they were trying to be rough. And I'm just like, no, get away. I would quickly kick a nurse out of my room. Definitely, especially if she's not listening to me as the patient. I don't have time for that. Um, and so from that point, uh, I don't, the last thing I remember is me being in the hospital bed and this, what is she, medical assistant? She was trying to take my blood pressure and take my temperature. She was being rough. We got into it. I told her to get out. And she said some words that, I said, oh no. I was going to file a complaint on her. Ain't no use of arguing back and forth because she was trying to be rough. And I was telling her, don't touch me like that. I can lift my arm up myself because I'm in pain. You guys don't know what I'm feeling. So as the patient, I'm telling you, don't touch me like that or don't touch there. And, I will say Washington Hospital Center, they are good when it comes to detecting and treating, but a lot of their nurses are not properly trained in patient care. They're not properly trained in having empathy for a person who may be experiencing something that causes them to be frustrated or irritable, and they're not listening. It's all about, you have to do this. And I will say, if you don't feel comfortable with doing something, don't do it. Consult with your doctor. If they're not explaining why a certain procedure or why they want you to take this certain medication that you have not taken before, consult with you. Ask them to call the doctor on call. And you can discuss with the doctor why this particular medication is being prescribed to me. Always, always make sure you understand what is happening. And if for some reason you're not able to communicate with them, I will say please have family support that is going to communicate with these doctors and these nurses on your behalf. Because I feel like if you don't have support, they can just feel like they can treat you any kind of way. And that's just not cool with me. Regardless of your religion background, your race, your gender, everybody should get the same treatment, which is fair and which is exceptional and not be, like just judged. So with that being said, I had went to, that's all I remember from that point. I was in the ICU for, I don't know, I think like 7 days. I don't know. I was not aware of nothing that was happening. And so I did have family support, my two sisters, my mom, my brother, my brother-in-law, um, my friend, Cupcake. um, so, and I got calls and stuff, but of course I can't answer the phone because I'm in the ICU. So, my family, the doctors were discussing with them, and my family, they had to make medical decisions. My kidneys were shutting down. They had to shock me back. My heart had stopped, and they had to shock me back. And these are all the questions. My family had to say, like, okay, they want to do this type of treatment or they want to do this. So mainly it was my sister, my next to the oldest sister, who were making like a lot of the decisions, but she would consult with my mom and my brother and my oldest sister. Um, and also, my sister is in the medical field as well. And so she would consult with her boss at work. And I want to give a shout out to her boss for explaining a lot of these treatments to my sister and giving her medical advice about these things they wanted to do to me while I was in the ICU to keep me alive. So, I didn't know a lot of this stuff was going on. And so at this point, I actually was diagnosed with the antibody-mediated rejection of the transplanted heart. And, when I came out of the coma, because they had me in a induced coma because I was in so much pain, and just a lot of stuff was going on with my body. And so when I finally, woke up and I could, when I came to, it was like I had a breathing tube down my throat, um, you know, and it was a lot of people that came, it was people that came up there to see me. And shout out to KK. She is someone who came to see me, asked about me when I needed something. She helped me out a lot when I was in the hospital. I want to say thank you, because you didn't have to, but I thank you for your kind spirit and just the love that you showed to me. And I don't know how I could repay you back, but I really do thank you for everything. Um, and so, um, so the aftermath of that, my kidneys were still very damaged. And so I did have to do one session of dialysis. And this is the power of prayer and how God worked in my favor, because my kidneys started to recover on their own. So they said she don't need to do dialysis, because this was going to be for the rest of my life that I would have to be on dialysis unless they started to improve. But initially, if my kidneys did not improve while I was in the hospital, I would have went home having to have dialysis treatments like every week or something. But the prayer of family and friends and me praying, God answered that prayer. God blessed my kidneys. He healed my kidneys to go back to normal, where I was able to um, not have to worry about being on dialysis. And, this, I don't know. It's like, it's kind of funny to me because, like, I am an emotional type person, but for the most part, it's like, okay, this happened to me. I'm still here. Gotta keep it pushing. But I want to say this one thing. When my sister actually told me when I was in the ICU that my heart stopped, I broke down because it's like my heart stopped. Like, and then she was like, they will call, the doctors will call them and say it's not looking good. We don't know what's going on with her. So a lot of the conversation and communication with the doctors and my family were like, things are just not looking good, you know, and, we need to try this, we need to try that. But the part where she said my heart stopped and they had to shock me back, like, that hit me hard because I'm like, I could be gone right now. Like, literally, I could be 6 feet under right now. My son could be without a mother right now. But that's not what God wanted for me. He wanted me to be here. He kept me here for a reason. He kept me here for a purpose. He kept me here to talk about my testimony. He kept me here because he's not done with me yet. And I've always prayed to God after I got my transplant to please keep me here beyond my years. Keep me here to my son reach 18. And God never failed me. He has kept me here. He has been there for me when I felt alone, you know. And so it just made me reevaluate and just, I always started to look at life differently, but it made me more like, oh my God, like it never came to that point where my heart ever stopped, even when I had 2 heart surgeries. Like, it never came to a point where I was about to die and I could be dead. And so that just hit me hard. And, I just broke down crying. And, I just called everybody and say, you know what? I love you. Thank you for being there. If I ever did anything to hurt you, I apologize. I just wanted a clean slate. Like, I didn't want to hold any animosity towards anybody. I didn't want to hold any type of ill feelings. I didn't want to be angry about things that has happened in the past. I just wanted to let all that go. And that's where I am today. Um and so while I was in the hospital after coming out of ICU, because I started to do much better, I had to get a biopsy done. Those hurt. I had like different things in my neck, like IVs in my neck. It was just a lot that was going on. Like, you see me now, it's like, okay, but if you would have seen me in the hospital, like all these IVs in my neck, and like just so much my body has been through. Um, and so this last hospitalization at Washington Hospital Center, they treated me with plasmapheresis, which is a process that filters the blood and removes harmful antibodies. It is a procedure done similarly to dialysis. However, it specifically removes antibodies from the plasma portion of the blood. So they had to clean my blood to make sure there were no antibodies that was there by the donor. Um, and so I had to get this line placed in my neck. I think yeah, it was on this side. I had to get a line placed in my neck. This is where it healed at. And I had to go through the main vein. Um, and so, like, all my blood would be circulating. Like, it would take all the blood out, clean it through this big machine, and it was loud. And I put all the clean blood back in, and I had to do, like, I think I did 4 treatments of that. Um, and I was okay. I didn't have any side effects. I did well. You know, talking with the doctor before I received the treatment, they were saying, like, sometimes this don't work for every patient. Sometimes, you know, they have these bad side effects and they're not able to continue with this particular type of treatment to help with removing the antibodies. And, you know, I prayed on it and I said, God, it's all in your hands. If this is what you want to do to help these antibodies go, if this is the treatment for me, I won't have any side effects. And I didn't have any side effects. Um, so I got 4 treatments of those when I was in the hospital this last time. And so when I came home, I had to do, so when I got discharged on November the 14th, I had to do another treatment. It's called Velcade. And this particular treatment is actually like a form of chemotherapy for cancer patients, but you can also, it can also be used for, hold on, let me see what I have. So it could also be used to treat antibody mediated rejection as well. And so the Velcade is mainly used for cancer patients. It is chemotherapy, and chemotherapy, which is anti-cancer agent. It could be given through the vein, which is considered like IV form of administering the drug, or it could be given under the skin. For me, I got I think it was 4 shots. I think it was 4 shots at the infusion center and at Kaiser Permanente. And so basically, they did it under the skin. I didn't have to do the IV. They did it under the skin. Um, and so this was supposed to help kill the antibodies as well. So, you know, I didn't have any side effects with this. I say sometimes you may have like a migraine, like headache. It's other stuff that could happen. Fatigue. So yeah, I didn't experience none of that by the grace of God. Like I was able to, my body was able to take in these drugs and not harm me in a way where I was having these different type of, you know, side effects. And so I know what that feels like. These shots that I was getting, it was given. One, I think one was given in my, no, they were given in my stomach, and the only thing I really experienced was like soreness at the site, and it'll become red, and it'll be like, you know, sore for some days, and that was the only thing I experienced. Yeah. Um, so these were all the treatments I had to get. Plasmapheresis, IVIG, Velcade, and yeah, that was it. You know, they had to act aggressively to deal with these antibodies. And so I'm better. Um, I was able to get back to work. Um, and it's kind of weird because it's like I got back to work like nothing happened. It was just like, okay, yeah, I've been through this, and okay, I'm ready to get back to work. And I think sometimes I need to start processing the feelings instead of like not acknowledging it and just treating it like, okay, it happened, whatever. But really be mindful of what I've been through and to make sure I treat myself with kindness and don't put people ahead of me. Because, like I said, if you're not good, nobody else around you would be good. And so, that was definitely a main reason why I wanted to get on here and discuss with you guys the reason for my doctor's appointment, what had happened to me when I was hospitalized over a month. And trust me, I was like, I wanted to get home. Like, that hospital bed sucks. My back was in pain. I was experiencing pain. Um, and I just wanted to get out of there. And I was missing my son. Like, that was like really the main thing. Like, just I would call him every night, hear his voice. And just not being able to hug him and talk to him, and knowing that, he kept asking me, Mama, when are you coming home from the hospital? And it won't pay me because I'll be like, I'll be home soon. Because, they wanted to keep me as long as they can to make sure I will be okay going home. And I went and returned to the hospital. So I understood that. But as a mother, like, you missing your child, and he was not able to come up there because he was too young. They would not allow children his age to come up there. So I couldn't visit him. So he couldn't come visit me. But my sister, my older sister, Shell, and my next to the older sister, Nadine, and my brother-in-law, Cupcake, KK, they came up there and they came to see me. They checked on me, and it was just, oh, my mom always called, my dad called, my aunt checked on me. Like, everybody was just making sure I was okay. And that sustained me for, to help me keep pushing. But the main thing I was thinking about, like, okay, I know I want to go home, but I gotta do this for myself. I gotta do this for my son and make sure my son, when I do get home, that I don't return back to the hospital. So I gotta just do this, for my son. Um, and so, just after that, I had to stay in the house because, all these drugs that are cleaning my immune system, and, it affects it differently from normal people who haven't had a transplant. So, of course, I was worried about COVID. I got COVID test done before every procedure. I was, able to ask for, a COVID test, even if I wasn't, um, how can I put it? Even if I wasn't getting a procedure done, but I just wanted to make sure I was okay. Because being in the hospital don't always mean that you're safe. You can catch bacterial infections and stuff like that. So I just want to make sure I was good. No COVID-19 coming home, being around my son. So, yeah, and the food was disgusting. Let me just say that. I did not like the food, the hospital food. I was on a cardiac diet, a diabetic diet as well. So, the food was disgusting, but I was able to like order from Panera. And my girl KK, she would go get it for me and, bring it to me. She was a big help. And yeah, I didn't like the food. Some of it was okay, but a lot of it I did not like. What else? Yeah, but that was pretty much it. I was just grateful that I was able to come home before Thanksgiving. I got a chance to spend it with my son, my family. And I also was here out of the hospital for Christmas, New Year's Eve, New Year's Day. I was able to return back to work in January. So I still have to take it easy. You know, I still wear my mask, and I actually wear this one. This one is really good with making sure nothing get in, and it's really tight. So this is one. This is what I wear to work. Or if I'm going into like the hospital, or I'm going into Kaiser where there are sick people at, I always wear this one. And you know, I stay, well, this is one of my gloves, but I stay wearing plastic gloves when I go out. I don't want to touch the door of public places. I wear these while I'm at work, so I won't touch the mail. It's dirty. Also, when I'm going to apartment buildings, you know, having to open a door or touch anything that somebody else has touched, I use plastic gloves. So, and basically, that was it. But I think, I don't know, did I talk to you guys? I think I discussed what, oh, so the definition of the antibody mediated rejection is a type of late or chronic rejection. It is diagnosed by both the biopsy and detection of antibodies specific to the donor in your blood. So like I said, back in March, they detected some antibodies. But when I had got the biopsy done in March, they did not act aggressively. I guess they found a small portion. So they did not act aggressively. But as time went on, you know, it caught up. So, you know, I was very upset about that, and I made that be known that if they saw these antibodies, they should have acted during that time. So that's another thing, you know, I had to discuss with them. But the good news is, so my doctor said once the DSA blood work results come back and everything is looking good, they're going to come down on my steroids, which is the prednisone I take for anti-rejection. And I'm on 15 milligrams now. They want to bring it down to 10, depending on how those results look. And I agreed with that. But I did have my concern because, you know, I was on 5 milligrams of prednisone before my rejection, and I end up getting a rejection on 5 milligrams once a day. I end up also, I had 2 rejections, but I end up having this chronic rejection. And so, my concern was today is that I just want to make sure I don't have another one of these rejections by the medication for anti-rejection, the steroids, to be too low. So, you know, I agree. I do want to come down on it so my face can go down, you know, my blood sugar won't be as high. And so it is pros and cons to decreasing the prednisone. But, you know, as long as, you know, my doctor feel like it's safe, so, and I think, okay, well, 10 milligrams per is better than 5, so I think decreasing it to 10 would be great. So that's another thing we discussed. Also, I wanted to make this say this. I was asked about the COVID-19 vaccination, and I had to be honest and say I don't know if I want to get that vaccination because they have not done any studies on transplant patients to determine if there are side effects, if it could harm the transplant organ, if anything could go wrong, because our immune system is different from the average healthy person that they gave these vaccinations to. Even if they did it on over 60 years old, their bodies is still considered normal compared to mine. So I told my doctor that, I don't know if I'm going to get vaccinated. He recommended that I did because he said, according to, I think the CDC, somebody he said medically that, they recommend that compromised people who have compromised immune systems um, get vaccinated. But, you know, I told him that's something I would have to think about. I understand he want to make sure I stay safe, I'm okay. But that's something I definitely is going to think about deeply. Um, so that was just another thing I wanted to update you guys about the vaccination and just my perspective on it. For me, I can't speak for everybody else. Everybody else have to make their own decision according to their health situation, according to their beliefs, what they feel, them being comfortable or uncomfortable with it, them not trusting this particular type of drug, the side effects, and things like that. So, yeah, that was about it. So I just want to thank you guys for tuning in, listening to my story. If you have any questions, you want to comment, please comment below. Click the like button. Show your girl some love. Pass this on, share it. Have other people subscribe to my YouTube channel. It's coming from the heart. It's coming from my personal experiences. And it's all love. I'm gonna try to get back on here maybe sometime this weekend and let you guys know what's going on. And definitely I will update you guys on my DSA blood results to let you guys know if they detected the antibodies or if they're gone completely. And everybody send prayers my way that these antibodies are gone, and I don't want to experience this type of rejection again. So I just want to thank you guys for tuning in. Thank you guys for, just being supportive just by looking at these videos and spreading the word. You guys have a great night. I'm about to get ready to go to bed. I have to go to work in the morning. And so, peace.